Hey, and welcome. Today, we're diving into something that is so important, but for some reason, we just don't talk about enough: postpartum pain. We're going to give you a real science-backed guide to help you get through it, to help you heal, and to do it with confidence. So let's get right into it. We're starting with this quote because honestly, it's the whole point. This isn't about being tough or earning some kind of badge of honor. It's about a medical fact. Managing your pain is absolutely necessary for you to heal, for your mental health, and for you to be there for your new baby. So that brings us to our first big idea. We've got to challenge this cultural myth that new mothers are just supposed to suffer through the pain like it's some sort of rite of passage. It's not. And look, here's the science behind why toughing it out is actually a terrible idea. When your body is in pain, it gets flooded with stress hormones like cortisol. And that's not just a bad feeling. Cortisol can literally get in the way of milk production. So the bottom line is, leaving your pain untreated can directly interfere with breastfeeding and, really importantly, it seriously increases your risk for postpartum depression. Okay, so to get a handle on the pain, we have to understand where it's actually coming from. It's not just one thing. So in this next section, we're going to break down the two main reasons you're feeling what you're feeling. So think of it like this. Your body is dealing with two completely different types of injuries at the exact same time. First, you've got these deep internal cramps from your uterus shrinking, and then you've got this more surface-level, localized pain from the delivery itself, from stitches or from a C-section incision. This is such a powerful way to think about it. Your uterus, which literally grew to the size of a watermelon, is now cramping down hard, like a clenched fist. These pains, which you'll notice are way more intense when you breastfeed, well, that's your body's natural tourniquet, stopping you from bleeding too much. They're a good sign, but that doesn't mean you have to be in agony. Now for that second type of pain. The severe sports injury analogy is just perfect. I mean, a C-section is major abdominal surgery. A vaginal delivery can involve serious tearing and stitches. Your tissues have been through a trauma. The nerves are all inflamed, and that's why you get that throbbing, burning sensation. It's a real injury, and you have to treat it like one. All right, so now that we get the why behind the pain, let's get to the how. How do we deal with it? This is your toolkit, your practical, proactive, 6-point plan to stay ahead of the pain, not just constantly chasing it. Okay, rule number 1 is the most important one. Do not wait for the pain to get bad. You have to stay ahead of it by staggering your medicine like this, taking paracetamol, then a few hours later ibuprofen, and so on. You're creating this constant shield of pain relief. It never gives the pain a chance to peak, and that is the secret to staying comfortable. Rule 2 is all about the magic of cold therapy, especially for that perineal soreness. This little DIY padsicle is an absolute game changer. The cold makes the swollen blood vessels constrict, and that throbbing pain just goes way, way down. Just a little tip, make sure you wrap it in a thin cloth and only use it for 15 minutes or so at a time to keep your skin safe. Rule 3 is so simple, but so crucial. You have got to empty your bladder every 2 to 3 hours. You might be wondering why. Well, it's because a full bladder literally gets in the way of your uterus. It pushes on it, stops it from contracting the way it needs to, and that can lead to more pain and more bleeding. This trick is brilliant. Seriously. Urine is acidic, right? So when it touches fresh stitches, it stings like crazy. But if you just use a little peri bottle or spray bottle with warm water while you go, you dilute the urine instantly. The sting is gone. It makes going to the bathroom about 1,000 times less scary. All right, rule 5 is all about physics. It's about protecting your stitches. If you feel a cough or a sneeze coming on, grab a pillow and press it firmly against your incision. This is called splinting. It acts like a shock absorber. And for getting out of bed, never ever do a sit-up. Always log roll to your side and then use your arms to push yourself up. I know, this is probably the last thing on earth you feel like doing. But trust me, lying in bed all day can actually make things worse. You get this awful trapped gas pain, especially after a C-section. A slow, gentle walk gets your system moving, helps get that gas out, and most importantly, it prevents dangerous blood clots. So along with the actual physical pain, you're probably also dealing with a ton of advice from people. Well-meaning, but a lot of it is just wrong. So in this section, we are going to bust some of those common myths with actual medical facts.
Okay, let's be crystal clear on this one, because it's probably the most harmful myth out there. The reality? The prescribed painkillers your doctor gives you are totally safe for breastfeeding. An incredibly tiny amount, less than 1%, actually gets into your milk. But you know what does affect your milk? The cortisol from your pain. That actually hurts your milk supply. So here's the takeaway. Taking your medication protects your breastfeeding journey.
This is another one you hear all the time. But again, think about it like a sports injury. If you sprained your ankle, would you put a heating pad on it? No way. You'd ice it. For the first 48 hours, heat will just make the swelling and bleeding worse. You need ice. After a couple of days, then you can switch to some gentle warmth to help with blood flow. So many women get told this, and it's just not true. That nagging back pain has nothing to do with that tiny injection. The real culprits? 9 months of your body changing, your ligaments stretching out, and now hours and hours spent hunched over nursing a baby. The fix isn't about blaming the epidural. It's about working on your posture and gently strengthening your core. Okay, we've gone over how to manage all the normal aches and pains of healing. But for this last section, we need to talk about what's not normal. These are the red flags. This is your safety net. Here's the deal. Your pain should be slowly but surely getting better every day. If it suddenly gets worse or your medicine just stops working, that's a huge red flag. You also need to be on high alert for any signs of infection, any sharp pain in just one of your calves that could be a blood clot, or any severe chest pain. These are things you call your doctor about immediately. No waiting. And I want you to remember this one specific feeling. It's very distinct. If you start to feel this extreme, intense pressure down there, almost like you are literally sitting on a bowling ball, that can be a sign of internal bleeding called a hematoma. That is an emergency. So we'll end with this. Your comfort while you recover isn't a luxury. It's not something that's just nice to have. It is a medical necessity. It is fundamental to your healing and to your health as you start this new chapter. You've got the knowledge now, you have the tools. So, are you ready to make your own healing a priority?